What are the symptoms that indicate whether or not you have diabetes? Diabetes is often known as an invisible disease, because many of the symptoms of diabetes are not unique or scary at first glance. The signs that could indicate type 1 diabetes and type 2 diabetes usually have many similarities. Both include high blood sugar and mood disorders. However, there is a distinction in the time it takes for symptoms to manifest. The following are some of the signs and symptoms of type 1 and type 2 diabetes. 1. Frequent urination. If you frequently wake up in the middle of the night to go to the toilet, you may wonder if something is amiss. Most people only need to use the restroom once during their 6 to 8 hours of sleep. If you do, it might indicate an issue such as diabetes. It is referred to as nocturia by physicians. A desire to urinate more frequently at night is one of the most prevalent early indicators of diabetes. When there's too much sugar in the blood, which happens if you have diabetes, the body has to get rid of glucose because excess is considered poison, and because glucose cannot be expelled without water, the patient pees more often than normal. 2. Increased thirst. Excessive thirst and the need to pee are both often early symptoms of diabetes. Your body is unable to use glucose from your diet. As a result, sugar accumulates in your blood. When your blood sugar levels are high, your kidneys work overtime to remove excess sugar. Because you're losing a lot of water, you may feel really thirsty. To stay hydrated, your brain will advise you to drink more water. As a result, more urine occurs. If your blood sugar levels are not controlled, the diabetic urination and thirst cycle will continue. 3. Excessive feelings of hunger. One of the signs of diabetes is that the body continues to send signals for additional food because the cells aren't getting enough energy. The bodily cells are hungry even when enough food is consumed. This produces a vicious cycle in which high blood sugar promotes insulin difficulties, which generate feelings of hunger and encourage overeating. If untreated, blood glucose is unable to enter body cells and is not utilized by the body, instead remaining in the bloodstream, resulting in high blood sugar. 4. Excessive fatigue. One of the most prevalent signs of all types of diabetes is fatigue. Diabetes tiredness is a term used to describe this condition in diabetics. Many people with the disease feel exhausted all of the time, regardless of how well they sleep, eat, or exercise on a regular basis. However, weariness does not just affect diabetics. It can also happen in people with normal or pre-diabetic blood sugar levels if their blood sugar suddenly spikes. 5. Unexplained weight loss. While a pound or 2 of weight loss isn't reason to worry, unexplained weight loss of 10 pounds or more might suggest that something is amiss, and your body is attempting to interact with you. Finally, this quick weight loss might be a sign of diabetes. In diabetics, a lack of insulin prevents the body from transferring glucose from the blood into the cells for use as energy. When this occurs, the body begins to burn fat and muscle for energy, resulting in a loss of body weight overall. This weight loss can happen fast, between a few weeks to a few months. 6. Mood disorders. Many people may be experiencing symptoms of common mood disorders, such as sadness and anxiety, without understanding that their blood sugar levels are fluctuating. If you have diabetes, you are likely to experience a variety of highs and lows. Your blood sugar levels have an influence on how you feel and can lead to mood swings. Diabetes can have an impact on your mood and mental health, although additional research is needed to confirm the link between mood and blood sugar. Evaluating the dietary and lifestyle consequences of prevalent mood disorders helps rule out lesser-known factors. 7. Slow healing injuries. When blood glucose levels are consistently high, white blood cell activity, which is a critical part of the immune system's function, suffers. When they fail to operate properly, the body becomes less able to combat infections and to heal wounds faster. Uncontrolled diabetes can lead to impaired circulation. When circulation slows, blood travels more slowly, making it more difficult for the body to provide nutrients to wounds. As a result, the injuries may heal slowly or not at all. 8. Blurred vision. Blurred vision makes it difficult to distinguish small details in what you're seeing. Diabetes can have several origins, as it might be an indication that your glucose level is out of normal, either too high or too low. Fluid seeping into the lens of your eye might be causing your vision to blur. As a result, the lens expands and changes form. These changes make it difficult for your eyes to concentrate, causing everything to appear blurry. When you begin insulin therapy, you may experience impaired vision. This is caused by fluid changes, and it usually goes away after a few weeks. Many people's vision improves when their blood sugar levels are normal. People who notice these symptoms should consult a doctor. Diabetes can cause a variety of serious complications. The sooner a person begins to manage their glucose levels, the better their chances of avoiding complications.